Welcome to today's podcast. My name is Pearlie Brewer, and I will be your host. Today's podcast guest is Dr. Richard Louis. Dr. Louis is involved in the NB trauma program. He's the injury prevention specialist with that program, and he's also the current chair of the board for the Atlantic Collaborative on Injury Prevention. So Dr. Louis is here today to talk to us about another aspect really of health and safety, and that's health and safety, especially off the job. We're used to having a lot of discussions about health and safety at work, but the reality is, statistically, when you look at it, more people are probably injured, or in fact they are injured, off the job than they will be in their life on the job. So we thought it was very important to get a different perspective today, and we certainly thank Dr. Louis for joining us. Let's start with who is Dr. Louis? Tell us a little bit about yourself and your background.
Oh, well, thank you so very much for having me. A little bit about myself. I grew up in the Canadian Peninsula, a little town called Tracadie. As you can imagine, my father moved there from Ottawa. He was a surgeon and decided to practice in the Canadian Peninsula in Tracadie. Brought our family there, myself, my mom, my younger brother, and younger sister. Eventually, as a lot of kids from physicians, we all decided to go into the medical field. My sister decided to become an ophthalmologist. My brother went into dental school, and myself into medical school. So you can imagine my mom's super proud of us. But as you can see, we decided to go slightly different routes. And for myself, originally, I wanted to come back to the Canadian Peninsula and open up my own little family practice clinic. But when I was studying for my medical licensure, I did develop an interest on how the healthcare system actually works. So there I decided to do a master's in healthcare administration, or maîtrise en gestion des services de santé, at the University of Moncton. And that's where my passion grew for preventive care as a way to ensure the sustainability of our public healthcare system here in New Brunswick and in Canada.
So I would think that, based on your current or your comment you made just a second ago, that your thoughts would be, are we doing enough in prevention, or do we need to be doing a lot more in prevention and maybe a little less in the after treatment?
Well, that's a great question, Pearlie. And it all depends on which branch of prevention that we're referring to. As we all know, when we're talking about communicable disease, that branch clearly did get funding, attention, whether it's political attention or medical attention, in order to address the recent pandemic. Same goes when we're talking about environmental hazards, whether it's stuff that you hear with Parley Beach, or inspectors going into our restaurants, making sure that our food that we're eating is good and isn't going to bring us into the emergency department. So those forms of preventive care have been well funded, well known, and continue to roll despite the pandemic and other stressors. However, when we're referring to chronic disease prevention, intentional injury prevention, with the latest discussions around mental health and addictions, those are gathering more and more attention and still has challenges, whether we're talking about fighting against obesity, trying to reduce rates of obesity rates in our young. There's still a lot to be done. But unfortunately, for us today, we're talking about unintentional injury prevention. And like you mentioned at the beginning, whether it's on the work site or at home, unfortunately, that's one big area that definitely needs a lot more attention and a lot more work to be done. But gladly, there's some work. There's WorkSafe, there's safety services, there's Trauma NB and other stakeholders that are really dedicated to injury prevention and are trying to make a difference.
So, Trauma NB, who are they? What do they do?
Well, essentially, Trauma NB is the lead agency that's there to support the communication between both health networks, so Vitalité and Horizon, the Department of Health, and Ambulance New Brunswick, essentially in order to ensure that New Brunswickers get the best critical care when we're being faced with traumatic injuries. Same goes with education, making sure that our healthcare professionals are well equipped in order to deal with traumatic injuries when they are seen in emergency departments across New Brunswick. But not only that, there's also the responsibility to lead with regards to research around trauma care. So there's those three big areas that Trauma NB has been involved with since its inception. However, there was a recognition about 10 years ago that there's more that needed to be done around prevention of traumatic injuries, instead of waiting for them to arrive and then dealing with them at a downstream approach. So that's where essentially I came into play with the trauma program, where at the time, after doing my master's at University of Moncton, I did my internship with a trauma program. At the time, I was fairly young, fairly new, and very passionate. And I remember at the time, my big project during that summer was looking at provincial legislation and comparing it to other provinces with regards to helmet use for bicycle users. So that really sparked my interest in the injury prevention field. Looking at what other provinces were doing, looking at other jurisdictions outside of Canada, seeing what's on their books, and seeing how, Scandinavian countries have a totally different approach to bicycle use, or even in Amsterdam and other European countries. So really, it's learning, and it was a great wake-up call just on bicycle safety. And essentially, after my internship, I was lucky enough to be able to apply for a position at the time for injury prevention coordinator with Trauma NB. And lucky enough, I got the position. So that's how my career started 10 years ago with Trauma NB as the injury prevention coordinator. As you can imagine, at the time, again, after having that experience with bicycle helmet usage, I was really wanted to continue along those lines. So I really worked on bicycle safety handouts, went into the parks, gave out free bicycle helmets. I did different type of interventions at the beginning, while I really worked on getting some data, knowing fully well that, when we're talking about injury prevention in the community setting, I don't have a big team working with me at Trauma NB. So I really needed to be sure that the time that I'm spending and the resources that I'm using are actually there to address the leading causes of injuries, right? And in order to determine that, I was lucky enough to be able to work closely with our data analyst. Since Trauma NB, we have our trauma registry. So each time we have a patient coming into the emergency departments across New Brunswick, if you meet a certain inclusion criteria for the level of injury that specific person has, you would be in our trauma registry. So from there, I do have a sense of what's happening across New Brunswick with regards to different type of injuries. So from there, my interest really expanded to try to address those leading causes of injuries. So essentially, with the help of my team at Trauma NB, was able to at least take the time to develop a strategic approach in order to address each one of those leading causes of injury. And I'm sure we'll be able to talk a little bit more about them, each one of them, a little bit later.
So in regards to bike safety, you mentioned the Scandinavians have a different approach. What would their approach be? You piqued my interest there.
Well, essentially, it's, for example, their perspective with regards to bike lanes, separated bike lanes from traffic. I know here in Northern America, the tendency is to paint lines on the side of the street in order to demarcate the difference between the roadway for our vehicles and the dedicated space for our bike lanes. However, we do unfortunately see higher rates of injuries because of that fact, where, as you can imagine, during the month where we do have to tend with slippery surfaces, we do unfortunately have higher rates of incidents. That's why, here in New Brunswick, we decided to push for legislation to counter that fact, things like that 1 meter law, in order to provide that space between riders and drivers. However, that 1 meter law, as good as it is, isn't comparable to a separated bike lane. So that's why I commend efforts done by municipalities like Fredericton or Moncton. I know recently they've made an effort to add, greater effort to have separated bike lanes. But as I mentioned before, more would need to be done. Not just spending money in order to create those bike lanes, but working with community and community members in order to increase the acceptability of having bike lanes in the first place, where a lot of too many people see them as impediments to traffic. Knowing fully well that people that ride bikes still pay taxes too. So they do need a lot more work in order to get to a position that is currently in existence in other countries.
So while we're on the topic of bikes, bike helmets, what do you see when you drive around City of St. John, or you'd see the similar thing in Fredericton? What do you see as far as usage of bike helmets? And are we seeing enough bikers with helmets?
Well, it depends. When you say bikers, it elicits two things, right? When we're talking about bicycles, yes, a lot more needs to be done. I know that the New Brunswick Health Council does student surveys, and I remember, if I'm not mistaken, we're still sitting at around 40-ish% of students admitting that they wear their bike helmets when they're on their bicycles. So having legislation isn't enough, right? So what can we do in order to help with that behavior? Compared to bikers, where we're talking about motorcycles, they tend to be responsible drivers. What the concern is, unfortunately, oftentimes is with those in vehicles that unfortunately are distracted drivers that don't tend to see our vulnerable road users like motorcycle riders. So unfortunately, a lot of unfortunate incidents are tied to either distracted driving or, obviously with any type of vehicle, there's also driver error. So I wouldn't want to put all the responsibility on our drivers.
Now, when I go to the Trauma NB website, it's organized around 4 main topics. Let's go through each topic and talk a little bit. Maybe I can get your general thoughts. We could talk for hours on this, this stuff, but let's sort of try to stay focused here. And on the Trauma NB website, the first topic they identify is called Road and Trail, which deals with everything from distracted driving, kids, car seats, seat belts, bicycle safety, off-road vehicle safety. What are some of your thoughts on those topics? What are you seeing? What are the statistics showing us?
Well, for myself, you have to think, like I mentioned before, is what are the leading causes of injuries? And even more specific, what are the leading causes of injuries per age group? Because depending on the age group, you have different leading causes of injuries. When we're referring to road and trail safety, for me, that's number 2 in my things that keep me up at night, things that really need to be addressed. For many, when we do refer to road and trail safety, you might think about a 30-some-year-old man after coming from work, stopping at a pub and drinking too much and getting into difficulty that way, incidents that way. Unfortunately, what the biggest concern is right now is males 15 to 24. Whether it's on ATVs or on our roadways. As you can imagine, on our roadways, they're just learning how to drive. They're going from getting their beginners to being able to ride on our roads, drive on our roads like everyone else. So for many, that's a new experience that unfortunately puts them at higher risk. For myself, I'm currently working with one specific school district in order to see if we can't implement a greater effort, targeted effort towards high schoolers in order to have some form of safety messaging within the curriculum, more specifically for grade 9 students. So for that, we hope to be able to pilot this and to expand it beyond just grade 9 students. As you can imagine, right now, when we're talking about safety messaging around road and trail safety, there's MAD, there's TAD, there's the party program, Preventing Alcohol and Risk-Related Trauma in Youth. But those are one-day events or one speech. What I'm looking for is what can we do before we leave before summer vacation, for example? Can we have a dedicated week before we leave where there might not be as many exams or whatnot? Again, I'm not a teacher, but to try to have some form of safety messaging, whether it's knowing water safety, bicycle safety, ATV safety, driving safety, or even even providing more information about recognizing your rights as a new worker. For example, if you're being asked to go and work at McDonald's and operate the fryer later, and you yourself, as a young 16-year-old, don't feel comfortable that you didn't receive enough training, do you know that you have a right to say no and voice your concerns to your supervisor, and to try to find ways to provide that reassurance so that you're trained properly to operate certain machinery? And that's just one example. So to provide that safety message, whether it's what you do after school, nights and weekends with your friends, or what you're going to be doing at your summer job, to understand that safety applies the same. And hopefully, to have that same safety message extended, like I mentioned, not just for high schoolers. My goal is to have all students, whether you're grade 1 elementary school, there's some safety message to say to those kids too, right? About playground safety, crossing, pedestrian safety, and other safety message that are just as important before leaving for summer vacation. So that's my work that I hope to have done, again, in collaboration with school districts across New Brunswick, in order to pilot, evaluate, and then expand with the help of those stakeholders on the ground.
So a number of questions for you. Messaging that would come from school districts within the school, messaging that might come from parents. As your researcher, have you done any research or have you read any research that would identify who youth would take the message best from, who they would tend to pay attention to more, who has the most impact on youth as far as what they would actually do or not do?
Well, Pearlie, that's a great question. And something, like I said, I've started this about a decade ago and I'm still learning. One thing that I've learned just recently is exactly around messaging for that target age group, 15 to 24, where they're so used to getting bombarded with high-level, high-quality messaging coming from Nike, Coca-Cola, Marvel, name it, right? How do you compete with that type of messaging? So originally, I remember about 2 years ago when we first did our provincial awareness campaign around road and trail safety, the goal was to try to work with a marketing team, Brainworks in Moncton, in order to tailor some form of messaging to that target audience directly. Year 2 did the same thing. However, I was lucky enough to be linked with someone at the provincial government who's been the lead coordinator for the Planet Youth implementation here in New Brunswick. So essentially, Planet Youth is a non-for-profit that helps implement the Icelandic model in order to reduce problematic drinking in youth here in New Brunswick. So it's a pilot project that's currently being done in a few areas across New Brunswick. And from there, they're learning about the best ways to address those issues, whether it's working with the family, working with the school environment, or working with after-school activities, or lastly, seeing what can be done with within relationship between peers. So those big four spheres are those big areas that we're learning from in order to see what type of activities, what type of interventions that could be done that would be effective in order to change behavior. Because that's the big end goal, is to try to get our youngsters to understand that certain behaviors aren't in their best interest, but not just for themselves, but for the benefit of others, friends, families, and their community itself. How do you get there? Before the experience in Iceland, that was a question that was being asked across the globe. But from their experience, we're able to learn and then try to implement what they've learned here in New Brunswick and other jurisdictions. I can say in Ontario, there's certain regions that they're piloting the Planet Youth model, and same goes in certain areas in the United States. So that's just in Northern America. I know there's certain areas in Europe that they're looking very, very closely in trying to implement the Icelandic model. So again, it all depends on having that provincial buy-in in order to allow for the pilot stage so that we can learn not just, for here in New Brunswick, but learn from other provinces in Canada, like Ontario, in order to be sure that what we're doing is actually going to change things on the ground, whether instead of providing a false sense of security that we're actually doing something.
So what have they learned so far?
Well, I can say right now they've done some initial surveys in order to understand parents and families and even the youngsters' perception with regards to alcohol and other substance use. So one thing that we're learning is how parents are more tolerant. And I mean, we could have understood that even before, how tolerant parents are with regards to alcohol use versus any other substance. Where students have even admitted that about 45% of the alcohol that they obtained were from known family members, the largest percentage compared to unknown people. We're talking about 10% or less, or other categories. So those, or even understanding if you know where your kids are past midnight. Imagine that. If you know where your kids are past midnight is a heavy predictor on if your child is going to be faced with problematic alcohol use. Imagine that, linking one with the other. So knowing this, we can address problematic drinking in youth by having some form of messaging to the parents to try to get them to play a larger role, to provide more after-school activities. Again, when I was talking earlier about those 4 spheres, to work on the other spheres, knowing fully well that, addressing youngsters directly is going to take more time, more, a lot more resources, and a lot more feedback from students themselves, youngsters themselves, right? Because at the end of the day, we do not want to do things that aren't going to be effective at the end of the day.
Okay, on your website, you talk about transport incidents, the second leading cause of injury hospitalization. What's the number one?
Oh, falls.
Falls?
And you obviously falls in older adults, but it still falls when we're referring to the age group of 0 to 14. It still falls when we're talking about the age group of 25 to 64. So it still falls. It's only when we're referring to the 15 to 24-year-old age group that we see transport-related injuries being number one. Number two, for those who would like to know, it's suicide and self-harm. So again, when I was referring about the attention around mental health and addiction, that's where finally they're getting the needed attention in order to address that. But again, for the 15 to 24, number one is transport-related injuries. So again, what are we doing for that specific age group? So again, 15 to 24, we talked about the efforts, but when we're talking about the other age groups, it's falls. Whether it's falls from furniture, from kids jumping on the bed, or falls downstairs with our older adults, where unfortunately the end result compared to our youngsters who are able to bounce back up after sustaining a fall, oftentimes older adults, we do tend to see them emerge and unfortunately have to in turn be seeing whether it's because of a hip fracture surgery, having to stay on the floor for multiple weeks. So that one is my leading concern. And for that, I'm so glad to be able to partner with some very great stakeholders in order to address specifically that. And I hope to be able to talk a little bit more about what's been happening, not just within New Brunswick, but across Canada, my efforts to lead efforts around falls prevention, more specifically in older adults.
Okay, number two on the list on the website, concussions. Give us your thoughts on concussions.
Well, essentially, for myself, there's two concerns. One is concussions in sports-related concussions, the typical concussions you might hear about on TV after Sidney Crosby and other high-level, professional hockey players and other contact sport players. For that one, the biggest concern is addressing expectations, where we do know more and more about the treatment, how to recognize concussion cases, how to treat concussion cases. And what we're learning is essentially each concussion is different for each person. How can we determine this one person is going to take about 1 week to recover from a concussion while the next one is going to take a month or two, or even longer in certain cases? So from that, it's learning from my colleagues from across Canada about ways to not just advocate for greater awareness about to recognize the signs and symptoms of a concussion, but working with healthcare professionals in order to be sure that they are well equipped in order to manage concussion cases too. So it's a collaborative effort between for example, the school districts. So we have teachers, we have coaches that are interacting with the students on a daily basis. So they need to be able to recognize signs and symptoms of that their policies are up to date. on how to manage students with concussion cases. Don't let them on the school bus, for example, because they don't have enough, direct supervision. Wait for a parent, even though it might be, a bother sometimes to get a call from your school to say, hey, come and pick up your kid. But there's reasons behind it. So there's that sphere of concussions, sports-related concussions, or concussions in the school environment. But there's that other sphere that's tied to falls in older adults, and it's concussions in older adults. And for that, I'm part of a national work group focused on just that and trying to answer questions on how do we manage concussion cases in older adults, where oftentimes it gets misdiagnosed or not diagnosed at all because of thoughts around dementia or cognitive decline. So how do you make that differentiation between cognitive decline and acute care cases of concussion? So that's the type of work that I'm engaged with also when we're talking about concussion care.
So how do you make that distinction? Well,
I'd love to be able to give you an answer, but unfortunately right now, that's an area where more work would need to be done. Mm-hmm. That's why, for example, we are encouraging research around that specific topic, where there are regular international conferences around concussion in sports. The same can't be said with regards to concussion in older adults. So right now we're working with researchers, we're working with other stakeholders within Canada, but also looking at outside to see what is currently being done and to try to create our first, here I'm saying it out loud, our first international conference on concussions in older adults. Might be here in Canada. So again, it all starts with asking the questions and dreaming big and just doing it and seeing if we do get that critical mass behind us, whether it's researchers, other injury prevention specialists, and others, in order to try to see if we can't get those answers to those questions.
Now, you mentioned a number of times falls. Any other comments you'd like to make relative to falls? You obviously seem to have a passion for that area. Any other things you'd like for our listeners to know when it comes to the topic of falls?
Well, a few things. One thing is the tagline, we all have a role to play, not just for falls, but for injury prevention, and to recognize that this is a team effort. To understand that, like I mentioned, falls happens at all ages, but as we age, falls can play a significant impact on our lives. And especially when we're talking about living at home as long as we wish, falls is one of the leading causes of loss of autonomy. So to really understand that, to break the ice, to have that conversation with a loved one is very important. And for that, there are resources out there like the Staying Independent Checklist that really outlines the leading causes of falls, and to have that conversation around that tool. And depending on the score, your older adult might have a better understanding about their risk of fall, and to in turn go see their primary care provider to continue that conversation. And obviously during the month of November, recognized nationally as Fall Prevention Month, is where we are making a concerted effort to push that message. Obviously to the greater public, but also there's a message that we're working on for our healthcare professionals. So for them, we've been working pretty diligently with the help of Horizon Health Network. They've created what we call the Collaborative Care Senior Health. So a bunch of stakeholders interested in senior care, where they've recognized falls in older adults as one of the two priorities. The other one being dementia care. So as you can imagine, they've asked me for my support, and I was glad to offer it in order to develop updated resources for our healthcare professionals in order to be sure that they're able to do a proper fall risk screening, and then in turn, the appropriate interventions for a patient that's been screened at low risk, intermediate, or high risk of fall. So essentially providing that support for healthcare professionals so that they are better able to provide that support to older adults at risk for falls.
The fourth area on the website, accidents at home, home safety.
Yeah.
What would be some of the comments or concerns you would have around home safety? Where the accidents happening, I guess, would be a good place to start.
Well, that's essentially an extension of the discussion around falls, where we do know, for example, for older adults, most falls happen inside the home, and more specifically in the washroom. Getting out the bathtub, getting up from the toilet. Those are high-risk areas when we're talking about falls. Obviously, stairs and getting out the bed. So if I had to point those hot areas, but for older adults that are at low to intermediate risk, we did develop a home safety checklist that we are advocating healthcare professionals and anyone, loved ones, to advocate the use of that specific tool. However, for those that are that go see their primary care providers or who have been identified as being at higher risk of falls, high or intermediate to higher risk, for them, doing it by yourself might not be the best way to go, right? For those individuals, we would encourage them to get some professional help in order to do the proper home safety modifications that would be tailored for their specific needs. So again, to encourage everyone to understand that they're not by themselves being faced with, trying to address falls or other injuries in and around the home, that there's people out there that are there to help. So that's why I also developed that home safety checklist for parents that have those younger kids that might be, highly mobile. For example, I have a 4-year-old that that's still giving me some difficulty, chasing after him. But that's the reality, right? It's to understand that you can't bubble wrap your kids, that they need to learn about risk themselves, but to at least provide an environment that's going to prevent them from getting traumatic injuries. Bumps, scrapes, bruises, that's okay. Daddy can live with that. But, skull fracture and broken bones, that's something that's different. So that's the difference when we're talking about injury prevention in the community setting. It's recognizing that, yes, you can do a million things, but what's even more important is to do one or two things that are really effective. So that's what my role is to understand and to advocate for evidence-based interventions that are really effective.
And for our listeners, I'd like to note as well that if you go on the Trauma NB website, there's all kinds of good information. There's all kinds of checklists. For example, on the topic of concussions, there's a checklist for coaches, a checklist for parents. There's all kinds of great resources on each of the topics that we talked about today. So don't hesitate. Obviously, in our time frame, we can't cover everything. So if you're looking for additional information, go to the Trauma NB website. Great resource. Now, just to finish off with, take a few minutes here. I'd like to talk about your work with the Atlantic Collaborative on Injury Prevention. Do you want to tell us a little bit about that and what your focus is?
Well, essentially, the Atlantic Collaborative on Injury Prevention is a great organization. It's a non-for-profit that's been there even before I started. As you can imagine, I joined ACIP about 8 years ago, where it's a partnership that's there to help with conversation with Atlantic Canada stakeholders around injury prevention. As you can imagine, like I mentioned at the beginning, injury prevention does not benefit from getting a lot of attention or funding. So in order to maximize our impact, we felt that it was very important to collaborate and to work together and to have a collaborative approach to injury prevention across Atlantic Canada. For that, we're lucky enough to get support from government representatives and government funding from all Atlantic provinces. And for that, we are engaged with different projects, whether it's creating resources around different injury prevention topics, whether it's alcohol use, the social determinants of injury, ATV use, and others. We do provide valuable resources to our stakeholders. Since ACIP isn't really a public-facing organization, you won't see ACIP ads on TV, for example. What ACIP is there for is to support our stakeholders like Trauma NB, like Safety Services NB, Injury Free Nova Scotia, Child Safety Link, or our provincial stakeholders with injury prevention information, data, or research. So essentially, that's one aspect. But like I mentioned earlier, it's also there to help with networking purposes, to help stakeholders talk to each other. Imagine that. That's going to conferences, for example, is a great way to network. Going to a symposium or other, events is a great way to learn about what's happening across Canada, or to meet other like-minded individuals. But here in Atlantic Canada, we can't really wait for a conference each time to meet up. So that's why ACIP is great in order to facilitate conversation around the leading cause of injuries, for example. So one thing that we've been doing for the past while is have conversations within a senior falls prevention subcommittee. So within that subcommittee, we have representatives from Nova Scotia, New Brunswick, myself, as you can imagine, Newfoundland, where we talk about resource sharing. So like I mentioned a little bit earlier about the Staying Independent checklist, we're advocating for everyone across Atlantic Canada to use the same tool when we're talking about breaking the ice, having that conversation with a loved one around falls risk. So now, for those provinces like Newfoundland or PI, who unfortunately wouldn't have as much resources as in Nova Scotia or New Brunswick to create a Staying Independent checklist, we can simply say, hey, use ours. We can have a conversation about co-branding, and let's see what we can do to support what's happening in your province. So essentially, that's the role of ACIP, is to help with doing projects, research that can't really be done separately in each province. Things like understanding the cost of injury in each Atlantic province here in Atlantic Canada, something that we felt was very important. So collaborating with Parachute Canada, a national not-for-profit, and the university in BC, we were able to get that data. And from there, we're able to identify what the leading causes of injuries are and what the financial and human costs are with regards to each one.
So what kind of numbers would you be looking at for financial cost and human cost?
Well, with regards to financial cost, again, we were able to get a subdivision by separate age group. So again, when we're talking about falls and older adults, here in New Brunswick, we're talking about a number around $144 million in direct healthcare costs each year. So if you want to compare that with transport-related injuries in our 15 to 24-year-old age group that I was mentioning earlier, that direct impact on our healthcare system here in New Brunswick is around 40 million. So you might say, falls in older adults is 3 times the direct financial impact on our healthcare system compared to transport-related injuries in 15 to 24-year-old age group. So that's just quick dirty math in order to provide some perspective on the different types of injuries and the different type of amount of effort that I put in order to try to address them, right? So for transport-related injuries, very important, but for falls in older adults, even more so.
One of the topics you mentioned briefly earlier, and I'd like to take just a second to talk about, certainly deserves a lot more than time in that, but suicide. What are we seeing statistically when it comes to suicide in our province?
Unfortunately, the pandemic had an impact on data. While I can't speak personally because, as injury prevention specialist with Trauma NB, I mainly look after unintentional injury. I know that my colleagues that do address intentional injury prevention are seeing the same numbers that I do. I know that through ASIP, there's some great work that's being done with the help of Injury Free Nova Scotia in order to get a better understanding about exactly that, what happened after COVID with regards to suicide and self-harm in that province. I'm definitely looking at the lessons learned from those focus groups, surveys, and other efforts that's currently being done and studied in Nova Scotia in order to learn from their experience and then implement effective interventions. And for that, it's going to need a collaborative approach. Whether it's through emergency departments, knowing fully well that there are screening tools readily available to be used in order to identify cases of, intimate partner violence or babies or infants being faced with unfortunate incidents being with intentional injuries. So there's tools there that could be used, but at the end of the day, it's recognizing that it's going to take some time for certain stakeholders to understand the need to take certain steps, knowing fully well that everyone's busy with other priorities. Obviously, today we're talking about intentional and unintentional injury prevention, but like I said at the beginning, there's still the C word floating around. I don't want to say it. And, things like, chronic disease prevention and environmental hazards that are still occupying, people's attention. So for myself, it's seeing where do we fit, right? That's why we do have our provincial awareness campaigns. Here with Trauma NB, we do have 4, but through ASIP, we're trying to share what we do and encourage other provinces to do the same. So instead of having New Brunswick doing Fall Prevention Month in November, Winter Safety in February, Safe Sports and Rec in May, and Road and Trail in August, if all Atlantic provinces or all provinces across Canada did the same, we would definitely have a greater impact. But that's the journey.
Well, look, thank you very much, Dr. Louis, for taking the time this morning with us. There's certainly so many topics we could talk about, and each one could take certainly a lot more time than we have. But the work you're doing, very important. 2 websites that you've mentioned this morning, Trauma NB and the collaboration website. Terrific resources, terrific information. Certainly like to remind folks to go to those. So thank you very much for joining us. This is today's podcast. See you next week.